Hello, the topic of today's lecture is Fundamentals of Homeopathic Pharmacy, Prevalence and Recognition of Homeopathy in the World and in Ukraine. The plan of the lecture includes the following items: state of development and implementation of homeopathy in different countries of the world, world manufacturers of homeopathic drugs, and the growth rate of consumption of drugs in worldwide practice. State of development and implementation of homeopathy in Ukraine. Definition of homeopathy. Samuel Hahnemann, the founder of homeopathic method of treatment. Classification of medicinal preparations used in homeopathy. Range of homeopathic dosage forms. Main direction regulation of production of homeopathic medicinal preparations. The need to create the document GMP in homeopathy. In different countries, the legal regulation of homeopathic medicines differs, from partial prohibition to participation in national healthcare systems. Almost all the leading countries in the world recognize homeopathy as an equal among equals in the structure of the national healthcare systems. For example, 60% of Germans have used homeopathic medicines and 90% of the users find it effective. In Austria, among 42% of citizens who prefer homeopathy, 72% of users find it effective. In France, 79% of French people have used homeopathy, and among them, 74% of users find it effective. Also, the United States of America implemented homeopathy into its healthcare system, including the possibility of creating insurance being treated homeopathically. That is why homeopathy, together with allopathy, is one of those systems of treatment that is available for most of people all over the world. And when we talk about homeopathy, quite often people think of India, because homeopathy is quite close to Ayurveda. They are national and traditional healthcare system. And India is one of the leading countries in terms of development and recognition of homeopathy, because they have Academy of Classical Homeopathy. It has 16 higher educational institutions with homeopathic faculties, Department of Homeopathy under the Ministry of Health, and Homeopathic Pharmacopoeia Center. Still, India is not the founder of homeopathy. The founder of homeopathy is Hahnemann, Samuel Hahnemann. He is German, so homeopathy was, let us say, founded or invented in Germany. But this system is very close to lots of folk, national, traditional healthcare system of different countries, including India. That is why they use it very, very much. In Asia and in Latin America, homeopathy is integrated into healthcare systems. The status of homeopathy is equivalent to that of traditional Western medicine or allopathy, and therefore homeopathy physicians provide primary care for most patients there. Homeopathic medicines are included in the European Pharmacopoeia. In France, more than 70% of the population choose the homeopathic method of treatment, which is included in the compulsory health insurance program. There is a research, educational, and practical base, namely French National Homeopathic Institute faculties for the training of homeopathic doctors at medical universities, 5 homeopathic hospitals, more than 100 homeopathic pharmacies, and offices of practicing homeopathic doctors. In Belgium, they have educational and research infrastructure created. They have Belgian Institute of Homeopathy, many homeopathic schools, and it is partially integrated into the health sector and insurance medicine. Germany, which is the birthplace of homeopathy, has 7 higher educational institutions with homeopathic faculties, a large number of homeopathic schools, clinics, and pharmacies. They have a very developed branch and network. And also they have lots of producers, manufacturers for homeopathic medicines. In Great Britain, they have a network of social infrastructure facilities, including 5 specialized homeopathic hospitals, homeopathic faculties in higher educational institutions. The recognition of homeopathy in the country is also evidenced by the presence of the Royal College of Veterinarians and the British Association of Homeopathic Veterinarians. I pay your attention that homeopathy was created for people, of course, but we also have lots of medicines and procedures for animals as well. Not only in Great Britain, of course, but they were maybe one of the first one to implement it into some associations. But of course, they have the same German and in India. Homeopathy is an established treatment method in the United States of America. This influenced the development of a huge number of homeopathic schools, colleges, universities in North America, to which only a highly qualified specialist in allopathic medicines can enter. So this is a very interesting system. Of course, the country is very large and they have schools and universities where people can start learning homeopathy and getting the degree of homeopathic physician from scratch. But in North America, a number of universities demand the person firstly to enter their traditional medicine to get some basic education there, and only after that, on the basis of quite a rough examination, these people can enroll to homeopathic schools and universities. So this is their result causing to get a very highly qualified specialist. In Florida, they have 5-element acupuncture academy where we have homeopathy, including some elements of Ayurveda. Bastyr University in Washington, Southwestern College of Naturopathic Medicine in Arizona. In Canada, they have homeopathic treatment is very much spread among the population. With the aim of receiving homeopathic education in the country, in Canada, there is a large number of homeopathic colleges, among which we have to stand out Canadian College of Homeopathic Medicine and College of Natural Medicine and Homeopathy. And when we talk about homeopathical medicines around us and the range of homeopathic medicines, then even though this system demands a very individual approach and maximal extemporal preparation of medicines, because the physician should talk to the patient for quite a long time to figure out which components, which ingredients will be useful for this very patient. Still, we have quite lots of industrially prepared homeopathic medicines around us. And now you can see that the number of producers of homeopathic medicines, I'm sure that you have already heard of them, like Bionorica, for example, or Boiron, or Hale, or Galen homeopathics. In Ukraine, we have Beleda, we have Elko, Arnica, Materia Medica, IRAS, National Homeopathic Union. Lots of these producers can provide population with very high quality, effective, and safe non-toxic medicines. And even though this range looks quite huge, it is not so huge than in traditional allopathical medicine, but still it's enough to meet the demand of the population. When we compare their growth rates of drug consumption in world practice, we can see that homeopathic drugs is 2.5 times higher than allopathic medicine in the world. In France, sales of homeopathic medicines are 15 times higher than in comparison to the previous period. And in the UK, annual sales of homeopathic medicines increased by about 16 million pounds. It doesn't mean that homeopathic drugs currently are more expensive or they are sold by more actively in comparison to traditional medicines. No, this comparison is the comparison with the previous period, these 10 years, current 10 years, and the previous 10 years. For the last 10 years, the increase of homeopathic drugs sales increased 2.5 times higher. People prefer using homeopathy more and more in the world. They find it more safe, they find it less toxic, they find it more effective, and that is why the sales of homeopathic medicines increase in most countries of the European Union and the United States. In Ukraine, homeopathic medicines that are sold in Ukrainian market usually comes from Germany, Austria, Ukraine, and the rest countries, they have almost equal ratio, not so much. Top 10 countries producers of ready-made homeopathic medicines in our Ukrainian market comes from Kiel, Germany, Richard Bittner, Austria, Deutsche Homeopathy Union, Germany, National Homeopathic Union, Ukraine, Materia Medica, Bionorica, Germany, Kalbeck, Germany, Laboratorias Boiron, France, Dr. Wilmar Schwabe, Germany, and Cefac, Germany as well. In homeopathic medicines market, the total share of domestic manufacturers is around 30%, while foreign takes up to 70%. And of course, currently, our producers try their best to provide the demands of our patients with our own national medicines. But not always it is possible because we need some specific and quite specific substances out of which we should prepare medicines, and we need to provide a very huge material base of growth of some plants, of collecting some mineral substances, but still our producers do their best. When we talk about what can we treat with the help of homeopathical medicines, we can treat almost everything. I said almost because when we talk about cancer and in oncology in general, I know that there are quite few, but they exist, medicines to treat such a group of diseases, but it is very complicated, and as far as I know, here in Ukraine, we don't have raw material to produce these medicines. As for the rest, here in Ukraine, homeopathical medicines are mostly prescribed for the treatment of diseases of circulatory system, respiratory system, digestive system, musculoskeletal system, urinary and genitourinary system, ophthalmic pathologies, and endocrine disorders. As you can see, quite huge and very big range of diseases was met. So as I mentioned, homeopathy can treat almost everything, so the same as traditional medicine. The advantage of preparation in the form of homeopathical granules, tablets, and oral drops was established, so these are the most popular dosage form. But except of this one, you can also find injection solutions, ointment, gels, flower species, syrups, nasal sprays, suppositories, capsules, eye drops, effervescent tablets, opodil dogs, oils. Range of dosage forms is very huge. So don't think that we only have some solutions and some granules. No, homeopathy includes lots of different dosage forms, among which granules, tablets, and oral drops are the most popular, but not the only one. The range of homeopathic medicines from the leading countries of the world has over 4,000 names of different kinds of medicines. So the range is really very huge. Since 2003, the Association of Homeopathy of Ukraine was established. The main goal of the association is to promote the popularization and improvement of the homeopathic method of treatment in Ukraine, to inform doctors of various specialties, as well as the general population about the possibilities of homeopathy. Most homeopathic doctors in Ukraine are active members of the International League of Homeopathic institutions using international homeopathic standards in the treatment of patients. Basically, it's very important for us to provide the knowledge of population about homeopathy so that people are not afraid of using this method of treatment, because still there are some kind of myth that homeopathy is not effective or something like that. And this association, one of the tasks of this association is to inform population about the possibilities of homeopathy, and they do it quite good. State Pharmacopoeia of Ukraine contains pharmacopoeial articles of homeopathic medicines. There is no separate homeopathic pharmacopoeia in Ukraine, but we have national articles and we use the international homeopathic pharmacopoeia as well. Here in Ukraine, we have about 300 homeopathic doctors practice in Ukraine, about 50 homeopathic pharmacies manufactures and dispense homeopathic remedies. According to the law of Ukraine, homeopathic preparations are classified as medicines, not as a remedy, not as a dietary supplement or something like that. It is a medicine, so homeopathy is recognized and implemented into their national healthcare system of Ukraine. Family medicine doctors prescribe homeopathic medicines together with traditional ones, and it is recognized and it is used. Each pharmacy dispenses homeopathic medicines, a profit of which is more than 30%. Homeopathic education is possible only after receiving higher education of traditional medicine. In most of cases, but still it is arguable because everything changes, and in Ukraine, a research, educational, and practical base has been created for the further development of homeopathy as an effective method of treatment. Namely, we have Kyiv State Institute for Advanced Training of Doctors, International State School of Classified Homeopathy, Kyiv Homeopathical School, National Medical University, named after Bogomolets, Kyiv Medical University, National University of Pharmacy, International Academy of Classical Homeopathy. But you need to feel the difference. When we talk about our university and your course, you learn how to prepare medicines. When we talk about medical universities, they train not the homeopathy and pharmacists, they train physicians, doctors. They train those people who are going to talk to the patient and who are going to prescribe the medicine, and you learn how to prepare this medicine. So the principle of division of responsibilities is the same as in traditional system of training. Pharmacists are responsible for preparing of safe, effective, high qualified medicine. Doctor is responsible of making the diagnosis and prescribing the medicine. And here is just a little picture for you to think of. This is the picture, the painting by Alexander Badenman that is called Homeopathy, Beholding the Horrors of Allopathy, from the collection of the State Gallery. What can you see on this picture? You can see on the left side the awful way of treatment of medieval ages. I think somewhere there in Europe, the traditional medicine was very rough, tough. It was very ineffective. It was very painful. People suffered sometimes even more from treatment rather than from the disease. On the right side, you can see people terrified with what they see because they know that this way of very rough and very strange and awful treatment can be replaced with homeopathic treatment that is mild, that think of the well-being of the patient a lot. Currently, traditional medicine is not so awful, of course. But in the medieval ages, the difference between homeopathic treatment and traditional treatment, it was very, very huge. So let's talk more about the homeopathy and compare it with allopathy. Homeopathy is a form of medicinal regulatory therapy that stimulates and normalizes the defenses of the body itself. It is a holistic medicinal system that has its own philosophy and point of view on all stages of human life. Homeopathy consists of two Greek words, similar and illness. So, and this term firstly appeared in the writings of Hahnemann in 1807. Homeopathy treats not just one disease, but the whole body of the person itself. And also, homeopathy says that we need to help our body to defeat the disease. When we talk about allopathy or traditional medicine, allopathy, opposite, the form of drug regulatory therapy aimed at treating diseases by administering large doses of chemical compounds selected on the basis of the principle, the same treatment for all. So in traditional medicine, we don't have so much individual approach. Basically, we have clinical protocols for the disease, and it doesn't matter do we have the disease in a kid, in a baby, in adult, is it a man or a woman? It doesn't matter. The clinical protocol of treatment is all the same. Well, for babies and kids, we have some differences, but when we talk about adults, clinical protocols are all the same. No individual approach, and also we choose the substances for treatment on the basis of opposite. When we have some pain, we prescribe painkillers. In homeopathy, we think of the human body in general. We make analysis of what happened to the person and why do we have this disease, and we think of how to stimulate the own immune system and the human body in general to defeat the disease. And we have maximally individual approach, including what happens to the person, not only physical but mental health as well. What is the general condition of the human body? So it is maximally individual approach, and treatment comes similar by the similar. We're going to learn it. So your knowledge in the part of traditional medicines, everything that you have used before, you will be surprised that their usage of some substances that you have already learned in traditional medicine is different to something that you're going to face in homeopathical treatment. So they are different. Allopathy or traditional medicine stipulates that homeopathic remedies must undergo state registration in the prescribed manner, and sometimes it is a problem because when we have a very high rates of potentiation, tradition still you haven't learned this yet. We're going to learn it a little bit later, but you're going to learn that potentiation is closer to dilution. The higher is the rate of potentiation, the less is the possibility to find at least one molecule of the substance in our ready-made medicine. That is why when we talk about state registration of the prescribed medicines, of their medicines, where we need qualitative and quantitative analysis, sometimes it may cause some problems, but it can be performed and new substances are registered. Everything's okay there. If a homeopathic remedy is prescribed by the doctor in the form of extemporal dosage form, then it can be prepared according to the prescription in specialized pharmacies or in specialized departments. So here is the principle the same to the traditional one. Who was Christian Friedrich Samuel Hahnemann? Hahnemann was a German doctor born on 1752 in Meissen, Germany, and being the physician, a very good physician, very effective one, he tried to find the other ways of treatment. So he was not satisfied with the existent ways of treating people. He didn't like them. He found them very harsh, ineffective. Lots of injuries were caused because of their traditional methods of treatment in that times, and he was searching for the new system. Of course, maybe it was quite hard for him, but being a good physician with lots of patients, being very effective, people really liked him. And he started implementing and creating the new ways of treatment. And later, on the basis of his practical work, he created the homeopathical way of treatment. His main works were Instruction to thoroughly heal old lesions and rotten sores, arsenic poisoning, guides to the pharmacist, organon of the medicine. This is one of their most important books that you must learn if you want to become a homeopathian doctor. It was repeated 6 times since 1810, and it is still valid. People still use it, and lots of useful information can be found there. Also, 2 more books about Haliburism of the Asian, Pure Medicine, Chronic Diseases, Their Nature, and Homeopathic Treatment. His works are learned, his works are used by all homeopathian physicians. They read it, they learn it, because main principles of homeopathy are described there very good. When we talk about the other homeopathians, lots of physicians in the period of time of Hahnemann tried to follow his system. They become his students. And of course, they also invented a lot, created a lot to fulfill the homeopathian treatment and homeopathical philosophy, let us say this way. Kent, Bunger, Dvala, Guerin, Stingel, Allen, Korsakov, Rybak, Vavilova, Varshansky, Alexander, lots of other homeopathic physicians and homeopathic pharmacists contributed a lot to the development of homeopathy is their system of treatment for people. Homeopathy is aimed at activating the processes of self-regulation with the help of medicines selected individually, taking into account the reaction of the body in accordance with the principle of similarity, simile similibus curantur. We treat similar by similar. The use of minimal doses of medicine substances, which are produced by potentiation or prerequisite by homeopathy. Homeopathy studies the individual characteristics and the reactions of the patient. The choice of the necessary homeopathic remedy is based on the comparison of characteristic symptoms and signs caused by the influence of the investigation medications with the symptoms of the disease of the particular patient. According to the theory of homeopathy, the healing process consists on displacing the disease from the body, which occurs due to the activation of its forces. You can compare this information to something you have already learned in the system of allopathy or traditional medicine. Allopathy is aimed in treating diseases, including the administration of chemical compounds in large quantities in order to achieve a positive therapeutic effect. A remedy chosen on the basis of the principle of contraria contrariis curantur. The opposite is treated by the opposite. Can cause one of the following: simply suppress the symptoms without affecting the cause, like painkillers or substitution therapy. Relieve symptoms by weakening the cause of the disease. For example, clearing helminths from the empties or getting rid of infections with antibiotics. Blow the pathway of symptoms with agonist treatment. Allopathical medicines usually the same medication is prescribed to all patients. In homeopathical medicines, we have individual approach, including treatment of some chronic diseases. In traditional medicines, medications are prescribed to treat individual symptoms. They are suppressed or they are elevated by weakening the cause of the disease, or the pathway of their development are blocked with the help of some antihistamines or painkillers or something like that. In homeopathy, most drugs treat the patient as a whole, so the whole body is taken into account. In traditional medicine, the condition at the time of the consultation is being treated. In homeopathy, we have holistic approach. What does it mean? Of course, when we talk about traditional medicine, we still have the so-called history of disease, but the doctor takes into account the condition of the patient when the patient comes to him. In homeopathic medicine system, we talk about their analysis of the whole life of the patient. It's the best choice is when you have your own homeopathic physician that knows you. It's like a family doctor, knows everything that happens to you during the whole life. So he can provide a true holistic approach, taking into consideration all individual peculiarities of a certain human being. Traditional medicine usually requires the course of treatment. In homeopathic medicines, medicines are taken only before improvement occurs. After that, it is not necessary. In traditional medicine, symptoms disappear without any order, so it depends. In homeopathic medicines, we have symptoms disappear following Heron's law of healing. In traditional medicine, we have side effects and some chronic diseases. In homeopathic medicines, we have only temporary deterioration. If the treatment of homeopathical treatment is good and effective, then there is no chronic diseases after that. How can we classify drugs used in homeopathy? Here, something that is similar to what you have already learned. So we can classify them by the source of raw materials, by the method of administration, by aggregate state, and by dosing characteristics. Let's start from the raw material. There are three big groups of raw materials in homeopathy: plant origin, most of drugs, mineral origin, around 20%, and animal origin, around 5%. It doesn't mean that we're going to kill an animal, no, but we can take some parts, some fur or some claws or something like that from the animal and use it as the raw material. But of course, 70% of homeopathic medicines, they are of plant origin. By the dosage forms, we can divide medicines into enteral, oral dilutions, tablets, and powders or triturations. I stress your attention that in homeopathy, powder equals to trituration. It's not like in traditional medicines where you have learned trituration as an intrapharmacy product. No, it's not that trituration. The other trituration, it's a powder. To enteral, we also have sublingual granules and sublingual tablets, rectal suppositories. In parenteral dosage forms, we have for skin application ointments, oils, and purple dildocs. For application in mucous, ophthalmic drugs, ophthalmic ointments, ear drops, nasal spray, and also we have injections. Homeopathic medicines are approved for use in Ukraine according to the order of the Ministry of Health number 165 on the development of homeopathic method of medical practice in the improvement of organization of providing the population with homeopathic medicines. Since then, there are lots of applications were done for this order, but it is still valid. This order also provides creation of the Center of Homeopathy of the Ministry of Health of Ukraine, conducting improvement cycles and technical for doctors and pharmacists in homeopathy, preparation of normative and technical documentation for the manufacture of homeopathic medicines at pharmaceutical factories, opening of homeopathic pharmacies, organization of homeopathic offices of medical institutions. As for quality criteria, medicines must be efficient, safe, and they should be in compliance with the requirements of pharmacological monographs, regulatory analytical documents, technical specifications, and so on. Product quality assurance is possible, subject to good manufacturing practice. As for pharmacopoeias, I have already mentioned that here in Ukraine we don't have the separate homeopathic pharmacopoeia, but we have articles about from homeopathy and homeopathical dosage forms. What do we have in the world? In the world, we have homeopathic pharmacopoeia of the United States, first published in 1897 and edited and republished numerous times. German homeopathic pharmacopoeia, firstly published in 1825, and which is considered to be the best. French homeopathic pharmacopoeia, Indian homeopathic pharmacopoeia, firstly published in 1962. British homeopathic pharmacopoeia, firstly published in 1870. State pharmacopoeia of Ukraine contains articles of homeopathic dosage forms since 2014. Before that, we used to use their German and American pharmacopoeias. Personal experience of developers is used as well. So we have numeral guides, homeopathian doctors and pharmacists all over the world share their experience and spread it maximally. So we can use also the experience of all physicians and pharmacists in homeopathy all over the world. So, determine the quality of homeopathic medicines, we should somehow use spectrophlorimetry, pH meter, spectroscopy, and all operations must be reflected on the protocols, visual control, organoleptic control, chemical control, To determine the quality of highly dynamic homeopathic medicines, only a qualitative method can be used, the clinical control method developed by Hahnemann. So we have a little bit other system of qualitative and quantitative control in here. Control system is described and includes control of compliance of initial products with their specifications, control over the conditions of preservation and storage of starting products, supervision of the quality of production procedures. It includes production and storage of granules and grains, production and storage of purified water, preparation of mother tinctures, matrix tinctures, saturation of granules or other carriers, supervision over the condition of working areas and equipment, sanitary and hygienic control. Here on the slide, you can see the list of the references with the guides in literature that is very advisable to read. Of course, in your course of Formel, you can find most of the useful information, but feel free to find the additional literature via the existing homeopathical associations and databases. Thank you for your attention.